Hey everyone, I'm Dr. Nick Gentry at Maverick Male Medical and Rejuvenated Medical Spa in Fayetteville, Arkansas. Welcome to our channel. Let's get to today's topic. And today I want to talk about stem cells. So I get lots of questions and people are very confused about this. So what are stem cells? Stem cells are your body's master cells, meaning that your pluripotent stem cells can turn into new types of cells. A stem cell can divide into other stem cells, or it can divide into cells to become heart cells, muscle cells, bone cells, liver cells. You get the idea. So what are the types of stem cells? And there's really three major types of stem cells, and some of them are really just used for research. So there's embryonic stem cells, and what those are stem cells from an embryo that's 3 to 5 days old in, say, a fertility clinic. So they take those cells and they grow them in a petri dish. The other types of stem cells are perinatal stem cells. And those are stem cells that may come from the umbilical cord of a baby, and you can actually store those for use in the future for that child. Sometimes they're used in other people as well, but typically those are only used for that child. The last type of stem cells is adult stem cells. And in an adult body, such as myself, they can be anywhere. But for the most part, the most concentrated areas are in the bone marrow and in the fat. And so what we do is we actually go after those stem cells that are in the bone marrow because one, they're a little bit easier to get, and two, the ones, in my opinion, when you go after the ones in the fat, it's difficult to keep them alive because of the process of trying to remove that fat and process it. So how do we do this procedure? What can it be used for, and what should you expect? So what we do is we actually give you a sedative. So we start an IV, give you a sedative so that you're nice and comfortable, and turn you over, and we go right into the back of the hip here, of the pelvis, and I actually numb that up and take your bone marrow out. I aspirate that bone marrow, we process that to get the stem cells out so that we can get them concentrated and get rid of the types of cells and the other debris that we don't need. And then, while you're very comfortable, you're sedated, you're numbed, we can inject the appropriate joints or other areas that we're treating at that time. And so the reason I like to do the sedation is to just keep my patient nice and comfortable. I've had lots of patients do it without sedation, but I really advise most people to get the mild sedation so that you're really comfortable throughout the whole procedure. So do you need a driver? Yes, if you undergo sedation, you will need a driver. If you absolutely do not want sedation, then we can offer you laughing gas, nitrous oxide, and you would not need a driver in that case. What can we treat with stem cells? So there's lots of research of treating all sorts of things from Parkinson's disease and Alzheimer's disease, heart attacks and strokes. The list goes on, but the fact of the matter is that most of those are very, very experimental. There is some data that shows that stem cells can be beneficial, but it has really never been proven, and no one really knows exactly how to apply the stem cells in a normal clinical circumstance. So what we do is we do sexual function and we do musculoskeletal injuries and arthritis. So if you have a fracture that doesn't want to heal, we could do stem cells for that. If you have arthritis and you're not ready for a knee replacement or not ready for a joint replacement, we can treat that with stem cells. If you have significant pain with intercourse as a woman, or if you have erectile dysfunction as a man, we can treat all of these things with stem cells. So what are the risks? Well, because we're using your stem cells from your body, the risk of rejection is zero. Because if you were to use stem cells from someone else, you could always have a risk of rejection or of that immune reaction. When you're using your own cells like we do, there is no risk of rejection. The risk of the procedure is really very low. Of course, there's always a risk with sedation, which is why we pre-screen all of our patients to make sure you're healthy enough for the sedation. We monitor you during the entire sedation to make sure that you're entirely safe. And then we also try to keep you comfortable. Anytime we do a bone marrow aspiration, there's a risk of bruising, bleeding, or infection, but that risk is very low. And so you may have some soreness and bruising the next day, but nothing major. So again, because we're using your stem cells and your growth factors from your bone marrow, the risk of a severe adverse effect is incredibly low. So if you have any questions about stem cell therapy, please give us a call and we're happy to answer your questions. So what other treatments can be added to stem cell therapy or used in conjunction with stem cell therapy to improve your results? So we do use some peptides such as CJC 1295 or BPC 157, sermorelin. We do platelet-rich plasma so that we can use your own growth factors to add to the stem cell therapy. We also can help you look at your nutrition and your lifestyle to help get you in a healthier place so that your stem cells are healthy, because your stem cells are exposed to the same toxins and same poor nutrition as the whole rest of your body is. And so the better overall your nutrition and health status are to begin with, the better chance you're going to have at success. So let's talk about who isn't a good candidate for stem cell therapy. First of all, if you have a severe bleeding disorder such as hemophilia, or if you're on blood thinners that can't be stopped due to an underlying medical condition, probably isn't a great idea to do stem cell therapy. If your arthritis is very, very severe to where the only option for you is a knee replacement, you may not be a good candidate for stem cell therapy. If you're too sick or too medically complex to undergo sedation safely, then I wouldn't really recommend stem cell therapy. And lastly, is if you've had radiation to the pelvis or to the bone marrow, I would not recommend stem cell therapy because your stem cells in that area may not be active enough and potent enough to treat the problem. If you have other types of medical problems, it would be a case-by-case scenario, and that's why we meet with all of our patients and do a medical history and evaluation and evaluate the affected injury or affected body part before we treat you. So we want to make sure that we're doing everything we can to make your treatment as safe as possible. Remember to like and subscribe if you want to learn more about functional medicine, regenerative medicine, and aesthetic medicine. Have a great day.